All medicines have the potential to cause side effects. It's very important that you talk with your transplant team if you have concerns about any of your medicines.
I'm having a lot of nausea, vomiting, and diarrhea, and I know it's from my mycophenolate.
This is fiction. While nausea, vomiting, and diarrhea are side effects of mycophenolate products such as Cellcept or Myfortic, it's important to understand that these symptoms may be from other causes, such as infection, other medicines, or other medical conditions. If your transplant team thinks that these symptoms are from one of your mycophenolate products, they may suggest that you take it with food, prescribe a lower dose, change to a different formula, or a different medicine. My roommate told me that I will lose all of my hair after my transplant because of tacrolimus. Fiction. Hair loss can occur post-transplant and typically affects women more than men. The cause of hair loss may be related to medical conditions or medicines. Hair loss may be common in the first 6 months post-transplant when your body is recovering from chronic illnesses and immunosuppression is the highest. Some patients may see benefit with certain vitamins or other medicines to help limit the hair loss. Be sure to speak with your transplant team before starting any over-the-counter supplements or prescription products.
I am never going to be able to paint again because of these tremors from my tacrolimus.
Fiction. Tremors can occur in up to 50% of patients taking tacrolimus. For some, these tremors are mild and do not interfere with daily activities. For others, however, simple tasks like using a fork to eat, writing, or participating in activities like painting can become challenging because of the tremors. If you experience tremors that interfere with your daily activities, talk with your transplant team. Your doctor may try transitioning you over to a once-a-day slow-release medicine that is a different formulation of tacrolimus and has been shown to improve tremors in some patients. Or he or she may try adding on another prescription medicine if needed. I worked so hard to lose weight before my transplant. Now I'm going to gain it all back because of the prednisone. This is fiction. Weight gain can happen after transplant for many different reasons. Common causes include fewer dietary restrictions, less physical activity, and your body using food and calories differently. Steroids can contribute to weight gain by increasing appetite and holding onto fluids. This is more common with higher doses of steroids, however. And taking steroids alone are typically not the cause of weight gain. A healthy lifestyle after your transplant that focuses on a healthy diet and regular exercise is key to preventing weight gain post-transplant.
I don't want to be on steroids long term because I'll never feel like myself again.
Fiction. Prednisone and other steroids affect everyone differently. Some people can experience mood swings or sadness, while others may feel happy or more energetic. Some notice nothing at all. It is common to experience a change in mood after a stressful life event like a transplant. High doses of steroids can make those feelings feel more intense. Different approaches can be used to manage changes in mood, such as meditation and exercise. If your transplant center offers a support group, I suggest that you use it. It's a valuable resource. Prednisone can also cause trouble sleeping, but it typically improves as the dose is decreased. But you should still try to take your prednisone in the morning to lessen this effect. My high potassium level is completely due to the medicines that I am taking. This is fiction. High potassium is a complication that can occur after transplant, and it can be dangerous to the heart. High potassium can be due to a combination of things, including medicines, foods, and how your body gets rid of potassium. There are several foods that are high in potassium, and some examples are listed here. You can also ask your transplant team for a list of foods. If your potassium levels are high, your transplant team may stop or hold some of your medicines, or they may ask you to avoid high potassium containing foods. If your potassium continues to be very high, they may give you a medicine to lower the blood potassium levels. I wasn't able to get pregnant before my transplant, so I definitely won't be able to get pregnant now. Fiction. While issues with fertility are common pre-transplant, many transplant recipients have returned fertility after transplant. Transplant medicines do not weaken fertility in women. There are, however, certain transplant medicines that can weaken fertility in men. Talk to your transplant team if you are male and concerned that your medicines may be decreasing your fertility. Many forms of contraception or birth control are available, including non-hormonal and hormonal forms, and you should discuss the best option for you with your transplant provider. All anti-rejection medicines are safe to take during pregnancy. Fiction. Some anti-rejection medicines used after transplant can be very harmful to the fetus. Specifically, mycophenolate products such as Cellcept or Myfortic can cause an increased risk of birth defects, and it should be avoided for at least 6 weeks prior to becoming pregnant. Transplant medicines taken by men, however, are not harmful to the fetus. It is important to talk to your transplant team well before you're wanting to become pregnant so that you and your team can make a plan. Communication is the key to success. There are many myths about medicines and side effects, and it's important to talk to your transplant team if you think that you are experiencing any side effect to any medicine, or if you want to become pregnant while taking transplant medicines.